Thanks. I guess my question is mostly for Dr. Kuehnert, but I am interested in these youngest kids, these kids at 3 going into Head Start. So these are not kids who are going to be necessarily affected by school lunch programs yet, or available competitive foods in the schools, or some of these other initiatives that we've talked about. I'd be interested in your thoughts as to what's happening in these, or what policy interventions might be most effective for these youngest kids.
Sure, thank you. I think there's a couple of policy interventions that have been really important, having to do with the WIC program. So again, this is a supplemental nutrition program that folks may be aware of that really supports low-income mothers and babies and children. And they've done a couple of important things. One is that they have really changed their focus in really actively supporting breastfeeding. And what the literature shows is that breastfeeding is, in fact, so healthy for so many things, but it is protective around obesity. So that's a very important policy change, and they've been putting resources into promoting breastfeeding and supporting women in breastfeeding, and starting to see more and more women breastfeeding that are WIC clients. The other things that they've done is really change policy in WIC in terms of the foods that can be selected. So those are a couple of things, and I think those WIC policies are probably one of the most important. I don't know if you have other examples.
Yes, we actually are working with our hospitals for Healthy Start programs, so that we're trying to get all babies leaving the hospital breastfeeding, and then at 6 months really trying to have a high percentage of mothers that are still breastfeeding.
Can I just follow up on that?
Sure.
My son's a kindergartner. Okay, so I wanted to ask you more about the schools. I live in a good town. I have a school that's well resourced. As you said, he gets 20 minutes for lunch. Okay, so he barely eats his lunch, much less. As soon as he sits down, he gets right back to it. There's this thing you haven't heard called the Common Core now that's got, reaching down to kindergarten. So he has half-day kindergarten. He only gets gym if we pay for the full day, which we have. So the children who can only afford half-day kindergarten get no physical activity, because all the time is spent basically now learning how to prepare for the 3rd grade MCAS test in reality. And I see this vividly, okay? And so how do we get, and then the school lunch, the cafeteria menu, 3 days it's chicken, it's some variant of chicken nuggets, okay? 1 day is pizza, 1 day is macaroni and cheese. So we have to bring lunch with him to give him a healthy lunch. And this is a school in a very good town, well resourced. How do you see, how are you going to be able to counter the pressure, in particular that the pressure on these MCAS tests and doing more around getting the children prepared to be literate in math? How do you counter that? And how are you going to get more of these schools to really play ball in these areas? Because I see it as a real obstacle.
There's a lot of data that shows that kids that exercise do better cognitively.
Yes.
So I think that we need to continue to sort of bring that conversation to the table. They're more focused in their learning if they get out and move around. There's less bullying. It's a better environment for learning.
Do the schools, are they listening?
No, I think you're absolutely right. I think we actually have mandatory requirements for a certain amount of physical activity in the state of Massachusetts, and I think probably less than 20% of our schools do it. There's a lot of pressure. There's bills every year that are submitted in the legislature. I mean, I would say talking to your legislators could hopefully pass some of these bills that put a little bit more teeth into requirements.
I think also finding like-minded parents and getting involved in that local school in terms of trying to have some influence. I think that's one of the ways. Now, the Healthy Schools program, if you go to the website, if you just Google Healthy Schools program, it's a very comprehensive program that really does look at involving parents and teachers and administrators in making changes that are kind of across the entire school.
I'm professor of immunophysiology and chemical technology. So the reason I came here, and I'm very happy that I came, because Bouvet College, where I'm professor, has pharmacists and nurses. And I'm motivated to have this pipeline of minority students who don't apply to do science. And pharmacists and nurses are there. They're in communities. So after this meeting, I realized that what we tried to do in terms of to get them interested in science could be extended to get them interested in good food. Because uniquely, Bouvet has nurses and pharmacists. They're right there. So I think from that point of view, I try to do something about it. They're politically big chat of nurses and pharmacists. What do you think about if we will pursue this initiative?
I think it's a great idea. I think anything to involve young people in issues and things that are important to them, and if you can draw that science and health connection and then make some connections for them, it sounds very good.
Our school nurses are some of the leaders in working on these obesity issues, and there's another avenue, I think, through wellness committees in our schools.
Thanks. Yes.
My name is Pauline Hamill, and I'm a professor in the health sciences department now, but for the last 4 years I was coordinator of Mass Motion New Bedford. And I want to thank you, Commissioner, for mentioning us. And I can assure you that 4 years ago, we didn't know what we were in for. We had no idea where we were going until we did an assessment in the city with the CDC change tool. And it was eye-opening. But I think one of the lessons that we learned is that people don't know what they don't know. And I think raising awareness, and it took months and months and months of the healthy choice, make the healthy choice the easy choice. I mean, you had to reinforce the information all the time. And I think we did see some wonderful changes over those 4 years. But we had to work with our mayor. You need the right mayor. You need the right policymakers. No question about it. And now, I even as I left the city, I was promised by the Commissioner of Department of Infrastructure, that he was going to keep this work going, and the sidewalks were going to keep going, and that they were striping the streets. It takes a lot of time, but we get there. And I also want to make a point about how we're focusing so much information and effort, as we should, into the earlier the better, working with children at the earliest possible ages. But this summer, we actually introduced Mass Motion Teens, and one of our students from the Health Sciences Department worked with me in New Bedford. And I'm putting you on the spot. She didn't know I was going to do this, but Julia helped I had two groups of Mass Motion Teens, one focused on healthy eating and gardens, and one on the physical activity component. And I mean, Julia can speak to this, but these kids, they were 14-year-olds, 14, 15-year-olds, did not have a clue in terms of connection to healthy foods and gardening and physical activity. I think we need to continue to focus not just on the really young children, which is where we want to start, actually prenatally. I mean, we want to start before these babies are born with the mothers. But I think let's not forget the teens. I don't know, Julia, do you want to add anything to that? She was great. And the kids didn't realize how much fun they'd have working in the parks and working in community gardens. And we've really focused on a children's garden. And so it's all ages, but we just have to keep the message going. And now we're working on capstone projects, service learning projects. We're going to keep this going.
Many of our Mass in Motion communities use teens on their projects they do. Some of them do photo shoots of going around and showing sort of broken down sidewalks and bring that to the town leaders and show them where they need to start to prioritize their repairs and development. And in our tobacco prevention programs, we have the 84 group, which is that 84% of kids don't smoke, and that we really focus our attention on the ones that do smoke, and that those kids get out and really spread the message amongst their peers, and peers listen to peers a lot better than they listen to adults.
Great, yes, next.
Hi, I was just interested in, I guess regarding both the presentations as well as your comments about the school lunches. In terms of things like the cost of healthy food that's being promoted or that schools are being asked to buy, or the perishability of, because a lot of healthy food is fresh food, like fresh fruits and vegetables. Is that a factor in terms of any of what policymakers have seen? And if so, how is that being addressed? Because I know it's expensive to buy healthy food, but maybe there's things that can be done or that I'm not aware of.
I think that has been an issue. I know particularly, I would say that in some of the waste, particularly around milk, that the white milk apparently, I've talked to food service directors, is in the trash a lot more than other beverages are. And I know it definitely is an issue, and it was a big issue around changing of vending machines. A lot of sports clubs and after-school clubs use the proceeds from that, and so they argued that that was taking away fundraising from them. But many schools have become really incredibly creative with having competitions that are physical activity competitions, so you're accomplishing more than one thing by getting people physically active and reducing the sale of candy bars to fund your school trips. So we actually have a good school nutrition guide that has a lot of examples from schools that have been successful in overcoming some of those challenges. But there are definitely challenges and barriers to changing policies.
May I ask you a question? I think we're going to take a few more questions, but let me ask you a question if you don't mind. We're right at the stage where the Affordable Care Act is about to be more fully implemented around the country. Starting January, there will be many more people that have insurance. And so we really focused in your presentations, I think, appropriately on the non-clinical side of dealing with this issue and changing the conditions in people's lives. But there is an interest about, is there a connection between what doctors may say in the clinical setting when a child is in danger of getting diabetes or a parent is overweight, and what happens in the community setting? Do you, each of you, think that there's an opportunity for us to make stronger connections between the doctor's office and maybe some of these community efforts?
And that's actually part of what Mass in Motion Kids is doing, is not just looking at the policy and the systems changes in the environment, but how to link that clinically. And so there's healthy weight clinics going on in the community health centers in both Fitchburg and New Bedford. And then there's also the idea of a doctor writing a prescription for how much physical activity they want you to have, or how many fruits and vegetables. And so
I think there are some opportunities that some states are looking at in terms of the food financing initiatives that essentially are providing some subsidies to make that transition. You know, I think what we will see eventually is the impact of the market. In terms of, if we do increase demand, there'll start being more supply, and hopefully that will work out, and prices will come down. But I think in the meantime, you have some things that really could be affected by state initiatives and subsidies that could really help, particularly the communities that don't have access to, Whole Foods, Trader Joe's, or even Walmart.
If I could just add too, I think both of our speakers referred to different aspects of national policy. One is the food stamps, or SNAP, and the other is federal subsidies for food. The Farm Bill is a major piece of legislation which influences the price of foods, because that's the bill that pours billions of dollars into subsidizing corn and soy industry, but not very much in terms of subsidizing fresh fruits and vegetables. And so I think a lot of people are looking at the Farm Bill not only because it includes the food stamp or SNAP component, but also because it offers the opportunity to take a look at those subsidies and see whether or not they're misplaced.
Hi, I wanted to thank you for all the energy and all the work that you're doing. But perhaps look more at the cause. If you think of the pace of change, and has there ever been anything other than sort of a war situation where food lines were disrupted to have such a massive shift in people's physiology so quickly? I'm having to read Salt, Sugar, and Fat by Michael Moss right now, and one of the things he points out is that the tobacco companies, when they were getting pressure about anti-tobacco, bought a lot of the large food corporations in the late 80s and have been really working on the packaged foods to try to get them even more enticing. And who could possibly have that large an influence across such a broad land area would be corporate America. So really to the Robert Wood Johnson Foundation, what kinds of conversations are you having with the food manufacturer, particularly processed food industries, and how responsive are they to you?
That's a very good point, and we are in conversation, and other partners are in conversation with corporate America as well. There have been, as I illustrated with McDonald's, there have been some small changes that have been happening, and there have been commitments by the industry with specific targets around both salt and sugar and calories. So I think that we're seeing some changes. I personally don't believe that they're enough at this point. But I think that what we have to do is kind of see that this is a dynamic situation, and I will certainly applaud the industry for at least taking the initial steps forward, and hope that, again, with more demand coming from consumers, from parents, that we'll see that momentum continue, and that these initial adopters won't be the only ones, and we'll see some significant changes.
Thank you. This is, I think, following up a little bit on Homer's question, but the question raised for me an issue that I know has been discussed for quite some time around this, which is the role of stigma, right? Do we want to, in a sense, in public health, is there some benefit to stigmatizing obesity, but also, right, and I've heard people say that in the sense of not wanting to normalize it. And yet, of course, there are great risks with stigma, not only the individual pain, but the reactions to it. So I guess I'm wondering, what do you think about the role of stigma? How do you avoid, or do you want to avoid, stigmatizing people who are overweight or obese with all these policies and these emphasis on healthy eating and looking a certain way?
Well, I never think stigmatizing anyone is a good thing, and many of the different areas of work I've been in, HIV and AIDS, the stigmatization has only made things worse. And so I think we need to find a way to help clinicians have conversations with patients about someone's weight that isn't necessarily about the number, and it's about the behaviors that they should be engaged in. The state of Maine, I was actually just at the American Public Health Association speaking with the state of Maine about this particular topic, and they have a 5210 campaign, which is that everybody's talking about the behaviors they want to see everybody have, which is 5 fruits and vegetables a day, no more than 2 hours of screen time, 1 hour of exercise, and no sugar-sweetened beverages. So not talking about weight and overweight, which I think is a really interesting model.
Yeah, I would agree, and I think we're starting to look at, really shifting the conversation from obesity per se to really changing the language and talking about healthy weight and healthy activity. So doing that reframing that I think is important in terms of not stigmatizing people, but really talking about it and framing it as giving everyone the opportunity to have a healthy life.
Well, thank you very much, Commissioner Bartlett and Dr. Kuehnert. I think if we looked at where we have come from just in the last few years, I think a few years ago we wouldn't be able to have this level of conversation about what's possible to change, where we've seen change, and what the difference that has resulted in terms of seeing some of the trends. So So thank you both for being a part of those changes, and also thank you so much for joining us tonight for this terrific conversation. Let me close also by drawing your attention to next week's topic. We hope you all come back. Next week we're going to be talking about one of the health issues where there is the most concern and discussion, and people have different perspectives on the issue, and that's the issue of legislating reproductive health and the questions that arise about reproductive health in health benefits, when legislators get involved, as well as when insurers get involved. And we'll have that discussion led by Associate Dean Arnett. So please join us for that, a very provocative discussion next week, this date at 6 o'clock. So again, thanks everyone for coming.